Kini ki ars paangot ki nurse ki balayo Shithi Thungkam hapo jong ka Meghalaya Medical Services Recruitment Board. Bachi spa kat sangot ki Nongtrei hapo jong ka National AYUSH Mission. Hagini ki jingalang le dan lang ka menteri ketenat ka kwat kakya i Dr. Ampurin Lingdo ki Head Officer Sarkar ki Nong Mikmat naga Dr. H. Gordon Roberts Hospital, Nazareth Hospital, Bethany Hospital, Supercare Hospital, Woodland Hospital, Bansara Eye Clinic, Suncare Charitable Trust, Children's Hospital, kiberan hakanong ba Shillong, nangta ke Dr. Norman Tunnel Hospital Hajawai, St. Joseph's Hospital Nongston, Macarius Medical Center Mairang, Holy Cross Hospital Tura, Tura Christian Hospital Tura. Abakran ni kajingalang Conrad Kongkal Sangma ulong mai kini kibalayo akam, bakani kalong palat ikakam, bakadi kajingkot. Kumta kidai banlet chaman la kinong pang da kajing slow bakajing la isnai, nang bakan wanra kajing kalai kajing imjongki. Menteri Rangba ulong ru benaduk kesenam arajar shipau kajing mang tengkah kakot kakya kelakio menta syaka Henry Usha kata nagalai sepak keluar tengkah syaka syajar nyo sepak keluar tengkah kesenam arajar apulai. Bala baha pisah nagabentak PHC, CHC, Subcenter, pat ki District Hospital. Bantai kajing tai baper ban penbiang tiar gitar bat kikor kibor, kikor IT bat kibai-kibai. Ulang bahagas nama rajar kat pra lama ada kejing na kejing tuna kejing dan ki doktor untuk sarkar ke Thungkam sans pa angot ki doktor hapo jong kalai benai hadian beliau jung menjor na kunhun menteri berkatong jong sarkar kalong ke basai ba unu nong shong shnong nom dan kam manek cebar ke jela Meghalaya banyo jing sumar.
Health is one of the most important pillars for us as a government. And it should be for every government, for every individual, for every family, for every society. And realizing the importance that we need to give to health, Dr. Sampath has shared with you that we have been, I should say, opening up the envelope for the health sector like never before. Meghalaya spends the highest in terms of percentage of the budget compared to any other state in the country on health. So it's not just a speech that I'm giving, but even in action, we are proving that health is one of the most important verticals for us, the most important pillar for us, one of the most important sectors for us. So 8% plus of our budget, which is the highest in the country, today is spent on health. Multiple reforms have been done when it comes to the health sector. Number of investments have been made. Different aspects of administration, different aspects of equipments, machinery, drugs, medicines being available, so on and so forth in almost every sector. When you look at the health sector, we have ensured that we are able to move forward. But large amount of funds today has been pumped in to improve the overall infrastructure in different PHCs, CHCs, sub-centers, civil hospitals and different district hospitals. We have a long way to go, but I can tell you that we are in the right direction.